The Lown Institute just released its report today, and CHA is actually the #1 hospital in Massachusetts for health equity. So, and that I feel like is genuinely well-deserved, because what we did during the pandemic is really step up and really meet the needs of our communities. We opened up all of our care to everybody. Insurance really took a back seat, and it had never been in the front seat at CHA, but it was way at the back of the bus now, which was great. We had, we had testing for everybody in the community. We had vaccines for everyone in the community. It really felt like we were part of the solution in our local Massachusetts cities and towns. And that felt amazing. That, interestingly, our engagement of our providers and staff went up during the pandemic because we felt that we were doing the work that we had been trained to do, and the silly had gone away. It was so liberating and so ironic that it takes that level of a cataclysm in our system to be able to just move the things aside that we've known the whole time don't matter. But now they're, of course, coming back. So how do we hang on to that sense of purpose and that sense of joy, honestly, in being able to help? Because people that go into healthcare, that's, at every level, receptionists, right? Nurses, doctors, physician assistants, we are there because we want to help people. And if you aren't there for that reason, you don't last very long, because it's an awful lot of work. But the guiding principle really should be, make it easy to do the right thing. And when you can do that, when you can align that, even just at the health center level, right, then people are happier, because that it unites their day-to-day with their sense of inner purpose. For example, for the longest time, we hadn't been able to allow people to get 3 months of prescriptions for medicines they've been on for years at once. They have to go to the pharmacy every month. This is a huge burden for someone who works 2 or 3 jobs, which is my patient panel. And all of a sudden that went away. We could now just prescribe 90 days of medicines for them. And they were so happy. And so were we, because I don't have to sign prescriptions as often. We're now able to prescribe an entire year of birth control for people when they need it. You don't have to go every month to the pharmacy again. We were allowed to send people to the place that they or I felt both was the best place for them to get care, and we weren't restricted in these networks, which is the current mode. Telemedicine has just been fabulous, because it allows me to decide with you what kind of interaction we want to have, right? Is it necessary for you to come in? In a continuity relationship, not that often. I do need to see you to see what's going on to make a new diagnosis. But once we have agreement on what we think is happening and the treatment plan, I can just touch base with you, just like we're having this conversation now, and get all the information I need. Anecdotally, one of my favorite parts of when telemedicine started was I started seeing all of these people in my panel I'd never met, because they just couldn't find the time to come in. And understand, I work at a site that's open 4 nights a week and had Saturday hours, and they still couldn't make it in. So they're really, the answers are out there. The question is, do we have the political and cultural will to put them in place?